Hello everyone. In this video we will discuss about the liver biopsy. In this we will discuss the indications, the contraindications and the methods used for the liver biopsy. Now going to the indications. There are many indications of liver biopsy. The first one is acute hepatitis, but it should be of the unknown cause. If the cause is identified, there is no need for the liver biopsy. Secondly, in diagnosis of metabolic liver disorders like hemochromatosis and Wilson's disease, in which quantification of the amount of the copper and iron levels is needed. So, in this case also liver biopsy is done. The liver biopsy can be used in some cases of alcoholic liver disease for the diagnosis and grading. It can also be used for the staging of the advanced cases of primary biliary cirrhosis and primary sclerosing cholangitis. Also, if the patient presents with persistently abnormal and unexplained liver function tests, if and the cause is not identified, then also liver biopsy can be done. Other indications are like investigation of a pyrexia of unknown origin. It's very important. Only of the unknown origin, pyrexia of unknown origin is the indication for liver biopsy. Also, in some cases where diagnosis of focal hepatic lesions needs to be made, especially if we are suspecting any malignant change. In cases of liver transplantation, histological monitoring is needed. For that also liver biopsy is done. Now going to the contraindications, they are very important. The contraindication first one is uncooperative patient. Now if the patient is not cooperative, there can be a movement during the procedure and which can lead to laceration of the liver and subsequent bleeding. Also in the cases of extrahepatic biliary obstruction. Now if there is a biliary obstruction, there will be dilated bile ducts, and the injury to dilated bile ducts can lead to biliary peritonitis. Other contraindications, they are like if there is bleeding diathesis or the patient has abnormal coagulation profile, which is very specific. If there is prolongation of prothrombin time more than 3 to 5 seconds, if there is platelet count less than 50,000, or the bleeding time is more than 10 minutes, these are all considered as the contraindications to the liver biopsy. But even if these are present and the liver biopsy is very much essential, it can be performed after the administration of vitamin K or fresh frozen plasma or a platelet concentrate. Other contraindication is tense ascites. Now, if there is tense ascites, there is increase in distance between the abdominal wall and the liver, and there will be failure to obtain the liver tissue. For this, the biopsy can be performed after removal of the ascitic fluid. Another contraindication is presence of hydrated cyst. Now, if there is accidental puncture of the hydrated cyst, this will lead to spread of the cyst throughout the abdomen, and subsequent anaphylactic reaction can also take place. These are the contraindications. Now going to the prerequisites before doing the liver biopsy. So prior imaging of the liver is must. There should be routine hemogram. The coagulation profile should be done. The patient should have given the informed consent. And lastly, blood grouping and cross matching for any complication should be done. Now methods. Going to the methods, there are many methods. First is the percutaneous method, and the percutaneous method can be either blind, guided liver biopsy, or also plugged liver biopsy can be done. Another method is transvenous or transjugular liver biopsy, and the last one is laparoscopic liver biopsy. Uh, Now we'll firstly discuss about the liver biopsy needles and then go to the method. The liver biopsy needles, they can be of three types. There can be suction type needles, there can be cutting type needles, and there are also spring loaded cutting needles. Now going to the first method, that is the percutaneous blind liver biopsy. Now as the name suggests, this procedure is blind, means this is carried out without any real time imaging guidance. And in this case, the patient is laid in the supine position, and the borders of the liver, they are identified by percussion. And after giving a local anesthesia, the biopsy needle is inserted either through the intercostal route or through the subcostal route. The route is decided according to the liver enlargement. If the liver is enlarged below the costal margin, we will prefer the subcostal route, and the liver biopsy is obtained and sent for the histological examination. This is the percutaneous blind liver biopsy method. Now, the complications of this procedure, the liver biopsy, is like there can be pain. Secondly, there can be interperitoneal hemorrhage. There can be biliary peritonitis if there is accidental puncture of the gallbladder. Also, there can be puncture of some other organs like kidney, lung, or colon, but this is very rare complication. And also, the overall mortality following liver biopsy is very less. Okay, now going to the second method, that is percutaneous guided liver biopsy. First one was blind liver biopsy. Now in this, as the name suggests, this is the needle which is inserted into the liver through the abdomen or through the lower chest, is done during real-time imaging of the liver, the ultrasonography, the CT scan, or during MRI. Okay, and this approach is suitable mostly these days. It is done occasionally where you go for guided liver biopsy under ultrasonography, or it is very much must for the biopsy of any focal lesions, because for the focal lesions we will require the real-time imaging of the liver. Now going to the another method, that is percutaneous plugged liver biopsy. Now in this biopsy, if this is the needle which is inserted, this is the center part of the needle, and this is the outer sheath of the needle which is inserted into the liver. So after taking the biopsy sample, the outer sheath of the needle, it is left in the place, and the obturator which holds the liver biopsy needle is removed. Now through this outer sheath, a gel or gel foam is injected to seal or plug the needle tract in the liver. This is done so as to reduce the risk of bleeding in patients, especially who has impaired coagulation. Okay, this is as the name suggests, the plug of gel is inserted into the liver after the biopsy. Now another route used is transvenous liver biopsy. Now this is done through the vascular system of the liver. Now in this, a small catheter is inserted through the jugular vein, which will go under the radiological guidance into the right atrium, into the inferior vena cava, into the hepatic vein, and from the hepatic vein this will be advanced into the liver and the biopsy will be taken. This is transvenous or transjugular liver biopsy route. And the last one is the laparoscopic liver biopsy. Now this biopsy is not usually done. Okay, this is only done if there is uh, accidental detection of any lesion in the liver during a routine laparoscopy of the abdomen. In this, what we'll do is a laparoscope is introduced through an incision into the abdominal wall, and the liver biopsy will be taken. But this is not routinely used. This is only used during uh, another procedure of laparoscopy is being done, and the incidental finding of liver lesion is there, then this method is used. This is all about the liver biopsy. Please like, share and subscribe to my channel. Thanks for watching this video.